Hey y'all, it's Kirk. So Ask Dr. Kirk today is brought to you by Treetop Christmas Farms. So you local folks, just in time for the holiday season, if you want a real Fraser fir Christmas tree, wreaths, any of your Christmas decor, Chuck and Roxy out there, I'll have the link below, can hook you up along with their big old petting zoo and all kinds of stuff to do for the kids. It's just a cool place, man. So Treetop, holler at y'all. Today's question. I'm going to cheat a little bit here. I got to kind of skip the line. And when you see why, what we're talking about, hopefully you'll forgive me. But, I get tons of questions, man, and I've loved them. So keep them coming, please. But sometimes you run across a question that is a bit time sensitive. And that's why this one is kind of skipping ahead today as the topic for Ask Dr. Kirk. Our question today actually comes from one of my local dudes, Malcolm, here in Hazelhurst, Georgia. Great dude. Malcolm asks, when is dementia diagnosed? How do I get someone who's starting to have symptoms to cooperate if they're in denial? When do I need to step in to help assist with daily procedures, finances? Also, what kind of supplements help? And he asked specifically about some creatine research. Wow. Okay. Malcolm, big topic, great topic, and a time sensitive topic. And this is why we're kind of skipping ahead to this one because dementia is a really tough one. And it's one of those kind of situations where making a diagnosis early is paramount to how this is going to go. So, first off, let me say my disclaimer. Of course, I'm not a neurologist by any means. I'm not a psychiatrist, psychologist at this point. But I'm going to address this from the education that I have because you guys asked me to make these things, Dr. Kirk, simple, and that's what you come to me for, and that's exactly what I'm going to do. So, first off, we should say dementia. What is dementia? Usually, when somebody says dementia, the first thing they think of is going to be Alzheimer's, not old timers, by the way, Alzheimer's disease. And they're kind of used interchangeably, even though those are not the same. Dementia, we should say, is a big generic term under which a lot of diagnoses occur. In fact, the neurologist will tell you that there's over 80, maybe 90 subcategories of dementia. So dementia is a word that we use to describe a collection of symptoms, this kind of constellation of symptoms, as they say. And these can involve memory, thinking, problem solving, language, perception, starting to have some of these issues as far as mood lability, and of course, everybody thinks of immediately of memory loss kind of situation. Well, what's actually happening is this. Dementia has all sorts of subcategories. Alzheimer's, of course, is one of them, which occurs, it takes up probably about 60 to 70% of dementia cases is an Alzheimer's diagnosis. But some of the other things, of course, you may have heard of Lewy body disease, vascular dementia, alcoholic-induced dementia, some genetic predisposition dementia. There's frontotemporal dementia. Oh gosh, there's a ton. Anyway, so what is happening is the basics. Here's the Dr. Kirk simple of everything to try to break this down for you. This is brain failure. This is the best way to think about it. And specifically, neuron failure. So what are neurons? Neurons are the things in our brain, nerve tissue, which is firing. It's what makes us make thoughts. These things are firing in our brain. It makes us think of things, makes us remember things. It makes signals our brain to tell the body to do all these kind of things. Neurons are super, super important. Well, for some reason, and there can be a whole host of reasons, neurons die and neurons shut down. And that's what's happening in dementia is neurons are shutting down. Now, unlike some of the other tissues that God gave us, neurons, unfortunately, don't readily regenerate. Like when we cut ourselves, our skin's going to regenerate. If we tear a muscle, our muscle's going to regenerate. If we, neurons don't do that. Neurons, unfortunately, don't have a great predisposition to regenerate in any sort of way. Now, there is some kind of rehab and stuff that can happen, and we can talk about some stroke stuff later. But in general, when neurons go, man, they go. So dementia, unfortunately, is one of these diagnoses that are made where it is progressive and it starts to go. And as things go, what you're doing a lot of times is you're buying time and you're trying your hardest to mitigate the symptoms as they worsen. So, how do we prevent these kind of things? Well, that's a hard question to answer. So, I'm going to go back to one of our previous Dr. Kirk things when I talked about the firemen and fire. So, a lot of times um, we're putting out fires, so we're helping symptoms. However, we need to get to the cause of why the heck was there a fire? And that's where this becomes tricky with dementia. So, dementia is one of these things that needs to be recognized early because dementia can be caused by all sorts of things that possibly could be stopped to help mitigate these symptoms that you start to have. So, like for instance, if we're talking about a pretty straightforward alcohol induced dementia, well, then of course, as early as you can, getting someone to quit drinking alcohol is going to, help alleviate some of these symptoms and possibly stave off some of these symptoms that they're having, right? But there's a whole other host of things that can cause these things. So electrolyte imbalances, vitamin deficiencies, whole injuries can occur, stroke related. Golly, there's a whole ton of things that can kick off us heading towards a dementia diagnosis. So the Dr. Kirk simple intervention is, and to answer specifically Malcolm's question, when to get diagnosed, dude, if you start having suspicions, get to your primary care physician, get to your person, get to your doctor, because a whole host of tests needs to be done. Because possibly we could find that cause, like we just spoke of, and help stop why there's fires, right? You want to know quickly, a whole host of blood work, some scans, depending on what the symptoms are. So we think of the usual, forgetfulness and these kind of things, which let me go ahead and tell you why that occurs. So one of the most common places, wait, let me back up before that. I'll say this. Your symptoms that you're going to have, even though I listed a whole bunch of them, are all going to depend on where the degeneration of the neurons is occurring. So, for instance, the occipital lobe back here in the back has to do with vision. Well, if the neurons start to die there in that occipital lobe, then you're going to have vision problems, right? The frontal lobe has to do with a lot of our decision making and what separates us from the apes. Why we're these the most advanced. If it starts dying down in there, then you may see there's some really hard decision making processes. So that starts to go down. We could keep on going. The temporal lobe, hearing, so it all depends on where it is. Now, one of the most common places where dementia starts to kick in and neurons start to fail is in a place called the hippocampus. And the hippocampus in the brain has a lot to do with memory and our sense of navigation. So that's why some of the most common symptoms you see are forgetfulness and getting lost and these kind of things. Well, there's a reason why that's the most common first signs you start seeing, is because the hippocampus is typically where a lot of dementias start off. In fact, Alzheimer's is one of the ones that hippocampus is usually one of the main places. So anyway, the point is, Malcolm, to answer your question, getting to your primary care physician and getting to the bottom of things quickly to see where the heck the fire is coming from, okay? Because there could possibly be a cause for these dementia symptoms that we can hopefully eliminate so that makes the prognosis of their dementia a little bit brighter. Unfortunately, when dementia starts to occur, this is a progressive disease, and so things just kind of go. But you're just, hopefully getting rid of the cause and then maybe mitigating things. So it doesn't advance as quickly. Or, perhaps you're getting on some medicines as quick as you can. Now, you may have heard of things like memantine and cholinase inhibitors, and these are the kind of the classics that people give early. And what you're doing in that time is you're staving off these symptoms, so that you can live a better life. And then, some of the other interventions are, of course, my brothers and sisters in occupational therapy, which I love, absolute heroes in occupational therapy, who start to, look at the home and start making things a little bit easier. So if this is a progressive thing, how do we need to be setting the home so that there is, easier living, so we're not a big risk for, falls and accidents and these kind of things. And, then we can also start talking about some of the things that you're talking about when we need to start talking about finances and some of the life decisions, because decision making becomes a difficult thing when someone really progresses in dementia. You asked me, how do I step in, when someone is kind of in denial? Malcolm, man, that is a rough question right there, because that's a tough one. I don't know the answer to it. These are tough conversations that we have to have with family members. And honestly, we're not loving them the best we can if we don't address some of these things. And they're hard subjects. Nobody wants to talk about it. Heck, think about it this way. If I'm looking in the mirror and I'm talking to myself and thinking, how am I going to do if I started suffering from some illness that was going to take away some of my independence? How would you do? I do terrible. I mean, let's be honest. That's a hard thing. So when we start to lose some of our independence and we start to having to start depending on people, when maybe you were someone who loved not having to ask anybody for nothing, those are tough, man. Those are really tough life things. So, but they got to happen. This is very similar to the discussion I have with patients about end of life discussions, when we start talking about, or do you have your written will and your power of decision making and everything, all that decided? Nobody wants to talk about it. Nobody wants to talk about it because, oh my gosh, why would we want to talk about death? I don't want to talk about this. I don't want to talk about end of life stuff. Those are tough, really, really, really tough topics. But are we really loving our people if we don't have those tough conversations? So that's the challenge. And, I don't envy you in any kind of way. I know you asked this as kind of an informational thing. You're probably not talking about anybody specific, but anybody that's listening to this and this is kind of hitting home, and this is probably in your wheelhouse of something you may be going through right now, I challenge you and I pray for you to have the strength to have the tough discussions, because it needs to happen. And when somebody is showing the signs of dementia and their life and their decision-making processes are starting to slip, we need to talk. We need to talk. And you need to get that person to their primary care physician for some workup as quickly as you can, because time is of essence in this situation. So, Malcolm, man, I hope this helps some. It's a big, broader topic, and man, if you come see me, yeah, you're local. Come on, man. You come talk to me. I promise you, I will give you all the resources I can give you to help us kind of sort through and sift through some of this stuff. But man, do I appreciate your question. I bet a lot of people listening to this appreciate your question today, Malcolm. Malcolm is a good dude, y'all, and man, do I appreciate him. So anyway, this is Ask Dr. Kirk today. I love y'all. I love y'all. Mean it. I really mean it. And Jesus loves you. And this is one that we all need to be praying about. Until next time, ciao.